It has been 2 years since the coronavirus first entered our lives and then took over. During this time, we have had multiple waves. Millions of people have died due to this infection. And right when the world had accepted that they had to coexist with Covid-19, the virus came back in a form more transmissible than ever before. Globally, a total of 6.5 million COVID cases were detected between 22nd and 28th of December. This is the highest figure since the World Health Organization declared the pandemic in March of 2020. Almost 900,000 cases were detected on average each day during this period. The World Health Organization had called the global surge a tsunami of cases from both the Omicron and Delta, one strong enough to push the healthcare system to the brink of collapse.
Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths. I'm highly concerned that Omicron, being more transmissible, circulating at the same time as Delta, is leading to a tsunami of cases. This is and will continue to put immense pressure on exhausted health workers and health systems on the brink of collapse and again distributing lives and livelihoods.
Between the 22nd and 28th of December, the global Omicron cases rose up by 37%. It is driving infection surges across countries, with many reporting record daily spikes almost each day. Let's now tell you what's happening in the United States as of now. According to the Johns Hopkins University, the United States has reached its highest ever average of new COVID cases. The moving 7-day average of new cases was well over 265,000 as of Tuesday, surpassing the previous peak of 251,989 that was set in mid-January this year. Though the rate of severe outcomes appears to be lower, the Omicron variant is currently overwhelming previously stretched hospital healthcare systems throughout the country and affecting a greater number of children in this wave.
We're seeing many more children infected at this point and being admitted to hospitals. We're seeing record numbers of admissions of all children of all ages, from newborns all the way through 21 years of age in hospitals and in ICUs with Omicron. Not to say that it's more severe, but it's, my experience so far is that it's not less severe, at least in kids.
For a better understanding of how the US is faring and how is it dealing with the Omicron variant, our correspondent Susan Teherani has sent us this report from New York. Have a look.
The East Coast, Washington, D.C., Virginia, and Maryland seem to be the hotspots for the Omicron variant. New York is also seeing a rise in cases, also a lot of challenges with testing. Long lines continue. Testing seems to continue to be a challenge, despite the fact that President Biden has vowed to get those tests in the hands of Americans. That's going to be sometime in January. The CDC, the Center for Disease Control, announced that it wants a quarantine time for individuals that are asymptomatic and infected to go from 10 days to 5 days. That has been met with some optimism and some backlash from officials. And President Biden also has said that he does not want to take the path to lockdowns, instead continuing to urge Americans to be vaccinated, boosted, and also get tested. Again, you know, the testing being the main challenge here, at least in New York and on the East Coast.
The surge is currently the worst in Europe. The rise in infections has forced governments to walk a tightrope between reimposing restrictions designed to stop hospitals from becoming overwhelmed and the need to keep economies and societies open. 2 years after the virus first emerged in late 2019, we're back where we started, it seems. France, for one, is reporting a tidal wave of infections. According to the French health minister, more than 200,000 new cases were reported in the last 24 hours. France and Europe's highest ever daily tally. The French health minister, Olivier Véran, warned that France could reach more than 250,000 daily cases by the beginning of January.
Les chiffres qui seront publiés ce soir par Santé publique France montrent l'augmentation continuelle du nombre de contaminations dans notre pays. Ce sont des chiffres qui donnent le vertige. Il y a 208 000 Français qui ont été diagnostiqués positifs au Covid au cours des 24 dernières heures. J'ai fait un rapide calcul avant de vous rejoindre. Ça veut dire que 24 heures sur 24, jour et nuit, toutes les secondes dans notre pays, plus de 2 Français sont diagnostiqués positifs au coronavirus.
While in the UK, Prime Minister Boris Johnson has said that around 90% of COVID ICU admissions are the people who haven't had their booster shot yet. Britain is currently reporting a record number of COVID cases. On Tuesday, in fact, the UK reported nearly 130,000 new cases, its highest ever daily tally. And even with the virus spreading at a rapid pace, the UK Prime Minister has stood by his decision to not clamp down on festivities. He has rather asked people to get vaccinated and enjoy sensibly, he says.
And I'm sorry to say this, but the overwhelming majority of people who are currently ending up in intensive care in our hospitals are people who are not boosted. I've talked to doctors who say the numbers are running up to 90% of people in intensive care who are not boosted. If you're not vaccinated, you're 8 times more likely to get into hospital altogether. So it's a great thing to do. It's very, very important. Get boosted for yourself and enjoy New Year sensibly and cautiously.
Now, there are a lot of questions that need to be answered when it comes to this new variant. And to answer some of these, we are now being joined by Azim Majid, who is a professor of public health at the Imperial College London. Professor, thanks so much for joining us on WION. Now, my first question for you, we're now witnessing a global Omicron surge. In your opinion, what can we expect in the next few weeks and months?
Good evening, Priyanka. As you mentioned in your news reports, we're seeing a global increase in cases of Omicron. So we've seen record numbers of cases in countries like the UK, France, Denmark in recent days. I think we can expect these high levels to continue for some time, probably for several weeks, if not even months. So unfortunately, I think many countries globally will face a very high level of cases of COVID-19 in the coming weeks and perhaps even the coming months. So this is something we're going to have to try to manage as best we can.
Right, absolutely. Now, it may be too early to make any predictions, but how long before we can conclusively know more details about the Omicron variant in terms of its severity of disease?
So in the UK, we're quite fortunate that we have good data coming through from our National Health Service. So the data we've got shows that the disease is less severe for individual patients than previous disease caused by, for example, the Delta variant. So it's about half as likely to cause hospital admission, perhaps even more than half, even less than half as likely. So it is less serious for individuals. But the problem we've got is because of the sheer number of cases, even though it's less serious for a person, at a population or country level, we'll see many people who are seriously unwell just because of the very large number of people who have got the infection.
Right. Now, for the sake of our viewers, can you also explain how can COVID, especially the infection that's caused by this new variant, be separated from the common cold? And my next question is actually in 2 parts. Are kids more susceptible in any which way? We're getting reports of kids being hospitalized with Omicron.
So to answer the first question, currently it's quite difficult to tell apart a cold from COVID infection. So when COVID first came, the symptoms were problems like a high temperature, continuous cough, or loss or change in the sense of smell. But because so many people now have been vaccinated or have a previous infection, that tends to modify the symptoms somewhat. So often the symptoms are things like headache, sore throat, mild cough, feeling tired, a runny nose, which can also occur with a cold as well, or with mild flu. So the only way to really tell if you've got COVID-19 is to get a test, because of the high level of immunity we've got in the population, the symptoms are not the same as they were 18 months ago, and so you need a test really to see if you have the infection.
Right. My second question was about children getting infected and how susceptible are they? And also, are they more prone to hospitalization in this wave?
There's no evidence in the UK that children are more susceptible to infection than adults. So this variant is very infectious. It will affect adults, it will affect children. So that seems to be the case no matter what your age is. In terms of severity, it does seem less severe for individuals than the Delta variant. But I think what we're seeing in the UK and elsewhere is just so many people being infected, including children, that some of those are getting, unfortunately, seriously unwell. So I think the fact we're seeing more seriously ill people, including seriously ill children, is just because we're seeing so many people getting infected at the moment from Omicron.
Now, let's talk about precautions that countries are putting in place. Now, many countries are talking about the isolation period, which to an extent has been reduced. Is this advisable according to you?
I think it's a matter of balancing the pros and cons. So there's no ideal isolation period. In the UK, it's 10 days for people who are not vaccinated. People who are vaccinated can come out of isolation for 7 days. Some countries are thinking about 5 days. I think, obviously, there's a risk if you have that period too short. People may come out of isolation when they're still carrying the infection, and so may infect others. On the other hand, because some people are being infected at the moment, that is causing problems for countries around the world. So healthcare workers, public transport workers, truck drivers, etc., teachers, policemen are falling sick, and that is causing problems for societies. So you've got to balance up the risks of a shorter isolation period with the benefits of a shorter period, in that then people can then return to work more quickly. So I think you have to kind of balance the two up. In my view, if you're vaccinated, I think 7 days is a reasonable isolation period if you have a test at the end to show that you've cleared the virus. But it does vary, I think, from country to country on your testing capacity and on your vaccination program and how well that's progressed in each country.
Absolutely. Let's talk about booster shots. We just heard the UK Prime Minister talk about the need for booster shots, even though he's advising people to be cautious and more sensible when they celebrate the year-end festivities. But is there now a question being raised on the efficacy of vaccines to a certain extent, with people with booster shots still landing up in the hospital?
So no vaccine is fully effective. So people are vaccinated. Some people will unfortunately still get ill with an infection. So with this strain Omicron, what we know about vaccination is that 1 or 2 doses have some effect, but 3 doses have much more effect in terms of protection. So with 3 doses, you have maybe about 75% protection from infection and a much higher protection from serious illness. Whereas 1 or 2 doses, the protection is much less. So it does seem that for this particular strain, the third booster dose is essential to limit the effects on both individuals and on countries. So that third dose is very important to control the effects of Omicron, and much more so than for other variants of Covid-19.
Right. Professor, just my follow-up question to that, wrapping up our discussion here. Can you just explain in simple terms how booster shots work, essentially?
So each time you get a vaccination, that increases your immunity. So if you have 1 dose, you get some immunity. If you get a second dose, you get much more immunity. And if you get a booster third dose, that increases your immunity even further. So research shows that the booster third dose increases antibody levels by 50 to 100 times. So it does have a dramatic effect on your antibody levels, and therefore your protection from infection. So each dose you get increases your immunity by increasing your antibody levels and your other immune protection. So the third dose is essential if you want to protect yourself from the serious effects of Omicron.
Professor, thank you so much for all your insights and explanations, and thank you for joining us on WION at this hour.
Thank you very much.
WION World is now available in your country. Download the app now and get all the news updates on the move.